So good afternoon, everybody. Most of you know me, Cindy Beck, and I'm the state advisor for Cal-HOSA, and most of you are my good friends that I've known for many years, and thank you very much for joining us. We have a couple of our state officers. Thank you for taking your time. I see we have an alumni. We have a classroom of students. Kyle Bayshore has a class going, and he's showing this to the class. So we have a lot of good interest and input for this. I want to introduce this project to you that is an important partnership that has formed between California HOSA and the California Department of Public Health. And so, Dee, could I ask you at this point, is there a closed caption we could add to the screen? Trust me, folks, we practiced this and we had no issues. So I'm not sure what's going on right
I
now.
don't, where is the close? Is it on more? Closed caption?
Should be down. Let me look.
I don't see it. Remote, annotate, pause, close. I don't see it.
Debbie, do you know where the closed caption would be located? Icon at the bottom left of the screen.
I can't get to that unless I stop sharing.
Okay, Debbie, we will get to that as soon as the slide deck comes up. So I just wanted to add a couple things while we're waiting for Dee to get the slide deck up. Not sure what, you know.
It's not up? The
No.
slide deck is not up?
No, it is a little swirly thing there. Now,
okay.
Now we have people again.
Yeah.
But let me just go on a little bit and tell you a little bit about joining this campaign. There are a number of activities going on with this particular campaign, and this is probably the first kickoff that you will see. We do have some other activities. The state officers have a social media campaign that they will be sharing with the Cal-HOSA members. They also have some regional project ideas that they will be sharing. CDPH is going to be joining us for a Career Pathway Development Institute that will be in Long Beach the 1st of November. And we're really excited about that. You will be seeing more of that because Cal-HOSA is hosting that. And we will have some really great information for you. Also, we will have a guest speaker at our virtual fall leadership conference from CDPH. And then we will have some representation with workshops and some interactive ideas. We've developed, I think, a good friendship so far, and I'm excited to move forward with this presentation as soon as the slide deck gets up, Dee.
It's not up?
No, it is. Yeah,
it is.
See it. Yes. Yeah, I can see it. Other folks, give me a thumbs up if you can see it. Awesome.
Yeah, we can see it.
Yeah, we're good.
So, Carrie, I am not privy to that. I, for some reason, have the little twirly box. So if I could just maybe turn this over to you and then we can get started. I apologize. There's a couple slides that were mine, but let's improvise if that works.
Of course, always. And thank you so much, Cindy, and completely agree. Hi, folks. I'm Carrie Rose. I'm with the Vaccinate ALL 58 campaign. I've had the honor of meeting some of the student officers already and delighted to catch up with the rest of you along with my colleague, Ashley Clark, who's with our CDPH communications team. And so today we're hoping to share with you some information and also be able to really go through questions you might have about the stats, the data, the latest on all things around COVID-19 and vaccinations. But then we'd also really like to share some ideas about ways that we can all partner together, particularly with the focus that Cal-HOSA has on student leadership and a possible pathway into public health. So that's our goal. And we could maybe go to the next slide if that's okay. since I think Cindy covered that. Yeah, so our agenda really is just to walk through very concretely. Here we are, back to school time. What does that mean for all things COVID-19? What's the guidance? What is the information we can share with you? Should you be interested in knowing it or sharing it in your communities? How we can answer any questions you have, and then the call to action. So next slide. This year, like all years, when school gets back in session, we're looking at congregating a whole bunch of people together in very small spaces, especially now that so many are back in person. So we have 5.9 million K-12 students enrolled in California schools for this school or last school year. And we know that with that close contact, COVID is unfortunately here to stay, and those kind of exposures increase. So important that information be updated and people have access to it so they know how to stay safe and take care of others. So today we're going to focus on that information about the vaccine, and then available resources for you and your roles. And I can appreciate we have students, we have teachers, there's going to be community members. So we'll do our best to speak on all levels, but just authentically from wherever you're at. When the time comes for questions, feel free to ask what's on your mind. So I'm going to turn it over to my colleague Ashley now, who is just amazing at her ability to take a whole lot of very complex information and distill it down. So Ashley, on to you.
All right, you're so kind, Carrie. But just as Carrie mentioned, we wanted to provide y'all with some updates on where we're at with COVID and vaccines here in the state. And I know many of you probably heard that last month, the CDC shifted some of their guidelines related to COVID. And so the good news is that some of those shifts align very well with what the state is already doing in terms of COVID guidance, such as staying up to date on all of your vaccines and boosters, staying home when you're sick, optimizing ventilation, especially in classroom and indoor settings like where you are when you're able to, having good hygiene, getting that hand sanitizer out, washing your hands very well. And if community numbers in your area are increasing, making sure that we're masking, testing, and doing all of those important things that we need to do to keep ourselves safe. Next slide. So here's a quick look at where we are with vaccines and COVID. So we've had well over 79.5 million vaccines administered here in the state. That's more than any other state in the United States. So California is doing a good job of getting those vaccines out, but there's still ways to go. So of those numbers, over 18,000 doses are being administered daily. So there are about 82% of our population is currently vaccinated, but with the under 5 vaccine, which is the latest population of folks here in the state that are able to get vaccinated, we're about at 2.67% that are fully vaccinated. And I believe at a little over 8% have had at least one shot. So the numbers are increasing over time, but we're really hoping to get some of our younger folks vaccinated. In terms of COVID, we've had over 10 million confirmed cases in the state. And currently we have a little over 12,000 daily cases on average. So COVID is still there. We're doing a little better than we were during the June, July, and August months. Case rates are coming down a little bit, but COVID is still here with us. And also with COVID deaths, there have been 93,000 in the state since COVID started here in California, with 34 deaths on average every day. So it's still something we have to be vigilant about. Next slide. So what we know about the vaccines is that they are safe and effective. Studies continue to show that reactions to the vaccine are mild and moderate, which includes pain at the injection site or some fatigue. But vaccines do lower the risk of severe disease, the worst outcomes of COVID-19, which are hospitalization and death. So getting vaccinated is a much, much safer way and a more dependable way to build immunity to COVID-19 than actually getting sick with COVID. Next slide. So here's a little look at unvaccinated versus vaccinated for those in the state that are. Unvaccinated folks are 6.9 times more likely to get COVID-19 than boosted individuals. Unvaccinated folks are also 11.7 times more likely to be hospitalized, and unvaccinated individuals are 11.2 times more likely to die. So those are some numbers we wanted to share with you all to kind of reinforce the importance of vaccination and keeping us all as safe as possible as we're still fighting through the pandemic. Next slide. So I hear a lot that folks are like, hey, COVID, it doesn't impact children as in the same way that it impacts adults. While a lot of kids are resilient and can come back from illness, kids are being impacted by COVID. Early in the year, COVID moved into becoming a top 5 leading cause of death in children, and it currently still is a leading cause of death. So folks are impacted by COVID. Kids are impacted. As you see here on the slide with the numbers, over 14 million illnesses, over 2.8 million kids 4 years and 2.08 million in kids 4 years of age and younger, 144th hospitalization, 1,700 deaths. So COVID can have intense impacts on children. And then there's the fear of long COVID. Next slide. So a little bit more about long COVID, because long COVID can indeed affect children, even if they've had very mild symptoms from COVID-19. So the most common symptoms that we see are fatigue, headache, insomnia, trouble concentrating, pain in your muscles and joints, and coughs. And that can have great impacts on your quality of life. So that limits your physical activity, feeling distressed about actually having COVID and the symptoms that come with it. There are mental health challenges that I know we've all been struggling with throughout the pandemic, and also not being able to participate in activities and going to school as we'd hope we could. So long COVID does impact kids in ways. But vaccines are here. Over 200 million people, including 29 million children, have safely received COVID-19 vaccines. And in the data, it shows that vaccines work very well in young children and that they are safe with having mild to moderate reactions. Next slide. We thought we'd provide an infographic look at vaccine timing, so you know how long you should wait in between your doses, whether it's you're just getting vaccinated and you're getting your primary series or your primary series and booster. This provides you a high level look at how long you should wait until you get your next dose. So children ages 5 and older are eligible for boosters. Children under that age are eligible just for that primary series, and hoping really soon here that folks 12 years of age and older will become eligible for the updated booster that the FDA has authorized and the CDC is contemplating currently as we speak. Next slide. So as part of this pandemic, we know that children have gotten behind in many of their vaccines, not just COVID. So we wanted to let folks know that as we're moving into this new school year and already are into it, it's important to make sure that you're up to date on all of your vaccines, including COVID. So you can go and get your flu shots and your COVID vaccines if you're eligible and need it. Next slide. Here's a look at the vaccination trends and numbers. So as I mentioned earlier, under 5 population, we've got about 2.67% fully vaccinated as of right now. And then those numbers continue to increase with each age range there, all the way up to 65 and older, who are our most vaccinated population, which is great because they're some of our most vulnerable. And also we have some numbers here by ethnicity to give you a look at how we're doing in each of these ranges, especially with equity. Next slide. So here we've got a couple numbers here as we're trying to make sure that all Californians have access to the vaccine and are vaccinated. Some of our most healthy communities are 82% fully vaccinated, while some of our least healthy communities are a little under 65% fully vaccinated. So what we really want to see is more of that equity coming into all communities in California to ensure that everybody has access to the vaccine and can protect themselves and their whole family from COVID-19. So there's still more work to do. Next slide. And here we just wanted to provide a little summary of what I've been talking about here so far. And that's the fact that COVID-19 does impact children. It is something that can really affect them in their quality of life and lead to more severe outcomes, hospitalization and death, long COVID, and multi-system inflammatory syndrome in children. COVID-19 vaccines also provide strong protection against severe disease, and the vaccines have been monitored very closely and are safe for all ages, including children. Next slide. So with that, if anybody has any questions about the vaccines, please don't hesitate to ask. You can take yourselves off mute and ask that way, or put your questions into the chat. So I'll wait a few seconds to see if anybody has anything that they'd like to ask. It sounds like no, we might be all good. And with that, I'll pass it back to Carrie Rose, my colleague, to talk about how everybody can get involved in this important effort to make sure everybody's vaccinated. Thank you.
Thanks so much, Ashley. I really appreciate that and appreciate all you do. I know that all of you are in relationship in your communities with folks who probably have a lot of wide range of feelings around COVID-19 and vaccinations. At least I'm guessing that might be true. It's certainly true for me. And wondering, given some of that data, sometimes I ask about it like, is there any of that surprises you or that you're wondering about? But I also am curious what you're hearing right now about COVID-19 and vaccines. So I'm just wondering if folks could help us out in the chat before I move to the call to action with letting us know, what are you hearing? Like, for example, one thing I'm hearing is, I'm over COVID, right? And yet here we are looking at these numbers, which can be pretty intense, right? And so just curious if folks could help us out with some comments in the chat for a minute. Or if you're not shy, feel free to say it out loud. We're happy to entertain it either way.
And you won't be offending us by asking questions.
No, you'll be helping.
I just want to say I've heard this from the beginning and I'm hearing it now more. It's best to get COVID so we can get herd immunity, and that solves the problem.
Yes, that is so common. So Ashley, I know that you talked about in the slide that it's actually better to get the vaccine than to get exposed and get herd immunity. Herd immunity. Do you want to speak to that? Because that is a very common concern that comes up.
Sure. And actually getting vaccinated does lead to us getting to that herd immunity standpoint, that position in society where, you know, COVID won't quite impact us as much as it has. But we're just not sure how getting COVID can impact any individual, and everybody reacts differently to getting COVID. So, but what we do know is that getting vaccinated is a safer way to get to that herd immunity level that we're all trying to reach, because we don't know how COVID will impact us. Vaccines have been shown to be more effective in lessening symptoms and even avoiding getting COVID at all. So we just want to make sure that folks know that getting vaccinated is a more dependable way to avoid those the harsher side of COVID-19 infection. So and vaccine is part of this, is part of us getting to that herd immunity level. So
yeah,
all involved.
Thank you so much, Ashley. There's lots coming in on the chat. Thank you all so much. This is super helpful for us because it also helps us think about how do we message this best for people with what you're hearing, what's going on locally. So a question that came up was, what were the determinants for the most healthy versus the least healthy communities?
You know, that's a fabulous question. What are
I know-
the determinants?
I know a little bit. Can I pop in on
Please,
that?
Carrie.
Yeah, so I know that as they're looking at equity, they're looking at a whole bunch of factors that have to do with access to healthcare in general, access to housing, what the mean income is of communities. So they're taking a whole bunch of different factors and trying to really determine like where are people hampered, what barriers are they facing? So they're looking at not just vaccination rates by people, but really entire communities. And what they see often, of course, is that the better funded communities have higher vaccination rates, right? And so that's part of what goes into those. I think that's most of it. I don't know, Ashley, if there's
Oh,
anything else.
that's great. You hit it, Carrie. Yeah, many different things that go into that metric that create that versus least healthy versus healthy. I think you hit it right on the head.
Thanks. Okay, another question is, there seems to be hesitancy among moms vaccinating kids. And that certainly speaks to that data you talked about, Ashley, where the 5 to 11 group, as you know, we can see with the newbies, right, the 6 months to 5 years, that vaccine's pretty new still. So word's getting out, but 5 to 11's been out for a while. So there's definitely seems to be some lag there.
Yeah, I think we definitely see as we get to younger populations, we do see a little bit of lower uptake in the vaccine. I think part of that is, you know, for me, I went to my pharmacy around the corner, got my shots in my arms, but parents might want to ask more questions to a medical care provider to ensure that the vaccine is right for their children. And I think that's especially true for even younger populations. If you're under 3, you can't even get a vaccine at a pharmacy, for instance. So I think being able to ask as many questions as possible to their healthcare providers and doctors to know if the vaccine is the right decision for them and their family is a factor, is a part of that. And but we know that there's more than that makes up everyone's decision. So I think the more information we can provide to folks about the vaccine is better, and being able to actually dig into those numbers themselves so folks can find that information is important too.
So on that note, I want to put a plug in for Ashley, and her colleagues have put together many really great toolkits and social media resources, flyers in multiple languages that are geared for different age groups. So we have like a whole 0 to 5 toolkit on the Vaccinate All 58 website, which we'll share at the end. But if you'd like to know more about those resources by age, we can probably help get you information to share with those moms, for example. Another question is, and this is a good one, the vaccine was developed too fast. Do you want to speak to that?
Sorry, there's a lot of noise outside my window. What was that?
Oh, that's okay. I know it never fails when you start a Zoom call that somebody's going to do a leaf blower, right?
Exactly.
Yes, it happens to me all the time. The question that I asked was a comment that I've heard also, which was the vaccine was developed too fast. That's why there's concerns about it.
Well, the vaccine, their starting point has been based on a type of technology that's been in development for 20 years. So it's not completely fresh, new. They are building on technology that was already there, but they were able to move at lightning fast speed to get the vaccine out to a larger breadth of the population, because they were able to do some of these clinical trials concurrently and do some of the things that would be spread out over time. They were able to fit into a shorter time frame, not because it's less safe or less effective that way. It's just we were able to kind of pull all of our resources and ensure that we're able to get this vaccine out safely, equitably, do our due diligence in studies. And we also have like several independent boards that review the safety of the vaccine. There's CDC has an advising committee that reviewed the data in addition to the CDC itself. The FDA has an independent board of advisors from all backgrounds, top medical professionals in their field that have reviewed the science behind the vaccine, as well as California we have our own layer of added review through this Western State Scientific Review and Control Board that also looks at the data. So it's been reviewed and studied by so many different folks in the field that are experts. And so I understand that there is hesitancy because it was done so fast, but it was done quickly because but even though it was done quickly, we were able to go through the same process as all other vaccines, just in a shorter time frame.
Yeah, I think I was surprised, honestly, my own self, to learn that the vaccine was based on 20 years of research, that just the right moment came where they could put it all together. I mean, right moment being in quotations, obviously, but yeah. So I can probably take this next one because it's really a comment noting that parents may not have gotten around to getting their kids vaccinated. It's not so much an objection as it is a, decision to either not take the time or not have the time, and how that can be detrimental. Really appreciate that. And would love to share that part of the call to action will be to share some resources with all of you about how to make mobile clinics, for example, possible in any neighborhood. Right? That there are resources by which we can really bring vaccines and make it as easy as possible for families who may be pinched for time or don't know or just haven't yet. No judgment. We just want to be able to get them the resource. And Wes had a comment, 6 of 27 juniors in our job shadow program are seeking religious or medical exemptions from the hospital requirement for COVID vaccination. Yeah, that's an interesting one. I don't know much about the exemption piece, but we could find out more unless you know something on that particular piece, but that's something we should be able to learn more about and speak to.
Yeah, for sure. I mean, again, I know everybody's on their own vaccine journey. And so for their various reasons, they may choose to get it or not get it, depending on the information that is available. And that's why we're trying to share as much info as we can and be as transparent with the facts and the data, and as transparent as we can, and provide you all with as much information as we can so that folks can make that choice if they want to get the vaccine or not. We're all on our personal journey. So yeah, I don't know much more about the religious exemptions, but I understand that that is something that folks are choosing to do.
Yeah, we'll find out more about that. I'm really glad you raised that issue. There's a point that people are saying, why get vaccinated if you're going to get COVID anyway? Like it's sort of inevitable. So why get vaccinated anyway?
For me, I'd say that getting vaccinated is the better way to protect yourselves from the more severe outcomes of COVID. So while COVID is out here, a lot of folks are getting it. Ensuring that you're not facing those the potential of being hospitalized or even the worst potential of death, I think it's best to get vaccinated because it lessens the symptoms and it prevents those harsher realities of COVID. So even though some of us may get COVID and are getting COVID, the hope is that the impact is lessened by having the vaccine.
Yeah. There's a good question, Ashley, about if someone who happens to be a minor wants to get the COVID vaccine, but the family doesn't want to let them, if they have options or choices.
That's a great question. I'm not sure what the options are outside of getting parental consent, but I think being able to share a lot of this information and data with your family and being able to talk through it. It's not necessarily always going to be one conversation, and then that changes everybody's mind. But I think continually going through and having these conversations, I mean, so many folks, I think the number was 200 million folks have been vaccinated. And I think that speaks very well to the safety of the vaccine. So just being able to continue having these conversations in your families, I think are important ways to make it clearer, or just make it easier to talk about the vaccine and not have as much fear surrounding it.
Yeah, a lot of it really is just helping get information into the communities so that, parents and families have more access to the data and maybe not so much on the myths and disinformation that might be flying out around there.
Yeah, that's a great point, Carrie. Mis and disinformation is rampant out there, and it's hard sometimes to know the difference. But making sure that you're using accurate and reliable sources is important to making sure that you have the right information about COVID. And we're trying to get information out however we can. For instance, we have a WhatsApp chat bot that we have for folks that can talk to the chat bot 24/7, ask any question about COVID, and the chat bot will do its best to answer your question. We want to make sure that folks have access to information when they need it. So yeah, it's just making sure that folks know where they can get the information. You can visit the CDPH website to learn more. COVID19.ca.gov is a great resource for folks, and all the data should be there for folks to peruse themselves.
Okay, Ashley, this is a great question. It's from one of the students. I'm going to ask you this question. What about the COVID crisis worries you the most, and what gives you hope for the pandemic?
Oh man,
Right?
That is a great question. My worry is that about the COVID crisis is that we aren't able to go back to spending time with our family and friends and doing the things that we love if this continues to move forward in a way that is unexpected, unreliable. We don't know what new variants are coming and how it may impact us moving forward. And that worries me because I miss friends. I miss traveling to see people. I miss going places, not being fearful of catching COVID. So I think those things, the fact that, we don't know how it will change and affect us in the future. So the uncertainty piece there. And what gives me the most hope for the pandemic, I think, is the fact that when I look at those vaccine numbers, helping us get to herd immunity so we can do those things that I was mentioning a few seconds ago, gives me hope in the fact that folks are here on this call, willing and wanting to learn about it. And the fact that we're all here together going through this and doing our best, I think that we will get to the other side of COVID at some point. What about you, Carrie?
I know, it's so interesting. What a good question. Somebody's going to go far in the world. I think that what worries me most is that, sort of COVID fatigue will take over and people will, just not have it in the forefront in terms of the care and keeping for themselves and loved ones. But I understand that, but I worry about it. But I have to say, I agree with you, Ashley. Like, what gives me hope is being part of this work, feeling like, there's something we can do, that there really are proactive things we can do that make a difference. And so for us in this role, it's being able to share information. I think other folks and those of you on the call will have other roles that you can have an impact with, but that does give me hope. Yeah. There's also there's a few more questions here. Boy, for folks who didn't necessarily have questions up front, I'm really grateful. All of these are good questions. So one comment is that heard from a couple of friends that their parents think COVID vaccines affect fertility and can threaten pregnancies. And before I turn that to you, I can say that I was on a call last night, a briefing with our partners with the Children's Partnership. And there was a physician on the call who helps us often with some medical questions, Dr. Shapiro, who addressed this very, very question. And so I know it's out there. I know people are talking about it. Dr. Shapiro was quite clear on our call last night that it is a fear. It's not based in anything right now, but that it's a fear, and it's very difficult once there's a fear out there to get the proper information in front of folks. So I just really want to acknowledge that there is stuff circulating around that, and that there are physicians who are willing to speak about it directly. And I'm not sure, Ashley, what else the California Department of Public Health has done to address that. I'm guessing there's probably either things in the works or already created.
I mean, I think what you kind of summarized from Dr. Shapiro is indeed what I'd say as well, that those rumors are just that, rumors, and that COVID actually is is a bigger risk than the vaccine. Getting sick from COVID has been shown to impact fertility in some women and men. So COVID is actually, and that's the thing, making sure that folks remember that COVID-19 is actually the thing that we're most impacted by and need protection from, is this disease that's wreaked havoc on so many of our lives. And fortunately, the vaccine the data is showing that vaccines are not affecting fertility in men or women, and that it is safe for those populations to get vaccinated. So yeah, Dr. Shapiro hit it right on the head from my understanding.
Yeah, but we can certainly understand also that people are coming from a place of worry about their loved ones, right? They want to make a decision, but they don't want to do any harm.
Of course.
Yeah, so being able maybe for you all to share what you've learned or what you know may help in those conversations. And we have also an email that we can share in the chat in a little bit about where you can actually just send questions that may be mis or disinformation, and ask that question directly, and someone from the California Department of Public Health will get back to you. So if you hear that and somebody wants to ask a question, or they have, want their family to email and ask that question, then somebody could get back to them that's like a neutral kind of person on that topic. Yeah. Okay, and then the very last comment, and again, I just can't thank you all enough for really your time and attention on these questions and these comments, because it really does both help us get clear on some of the things that we're doing that really do need to keep happening, but also some of the things that we need to spend a little more time on. So for example, I'm going to walk away from today thinking a little bit more about the religious exemption and some of the places where we need to do some work to have clearer information and conversations about. So so grateful to all of you. And I think the last question really is sort of in a way a variation on one we've talked about, but I think it comes up because it comes up every day in conversations we have, which is we're going to get COVID one day anyway, so it doesn't really matter whether you get vaccinated.
Yeah, right. I mean, again, I think we don't know how COVID will impact each person individually in their own way. So for me, I chose to get vaccinated because I wanted to choose a safe way to ensure that I didn't suffer from some of the worst impacts of COVID. And I think we don't know what will happen with COVID in the future, with future variants and how they'll impact us. So for me, in my choice for my journey, I wanted to make sure to get protected with the vaccine for those reasons.
Yeah, and I would also just personally, I know we all have our own COVID stories. My daughter teaches, one of my daughters teaches school in New York City, which was the epicenter early on in COVID. And so she was exposed very early on and luckily was able to get vaccinated, but had already had COVID, got COVID again and got much less sick the second time because she had gone through the vaccinations that she didn't have access to the first time. So I've personally, just been really grateful that she avoided the hospitalization and some of the other things that can happen with repeated exposures if you aren't vaccinated. Yeah. Thank you all so much. Thank you, Ashley. And keep putting questions or comments in if people think about it. But I'd like to just kind of switch gears a little bit and talk about that, kind of circle back to that whole thing about what gives us hope. What gives us hope is being able to do something about it, to be empowered, to be able to move forward, right? So we learn, we collect the information, and then we put that information into action. And I know a little bit about Cal-HOSA. I'm certainly learning as I go, and I'm so impressed and inspired by all of the work that you do. Folks that are on the call, your whole big, broader, wider network that we'll be sharing this with. So I wanted to make sure that you knew there's a few things that we could help equip you to be able to do should you be interested in more proactive work around helping to get either the information out or to get folks vaccinated. So maybe, Dee, if you're still with us, you're being amazing on the tech front. Could you advance to the next slide? Thank you. So there's 3 key things that we wanted to offer you to think about, and then we have some resources I'd like to share. So the first thing to think about is just become more comfortable learning and talking about vaccinations with people. One way to do that, obviously, is to look at the data, right? So we share data with you, even if you just take one data point, like, the communities in California that have the least socioeconomic advantages are the hardest hit and have the lowest vaccination rates. Right? Like, there's just a lot of ways in which the data can spark a conversation. So you can do a data search all throughout the state of California by going on the hyperlink that we've provided, and you can do breakdowns by gender, geography, age, ethnicity, so that you can be in charge of some of the data that you're collecting if you think that would be a helpful way to shape it for conversations. Another way to talk about vaccines is to become a vaccine ambassador. We put together, we being I had nothing to do with it, actually. I'm taking credit. California Department of Public Health put together a really great series of animated YouTube clips where people, in multiple languages, where people can learn about how to talk about vaccines with folks, everyday folks in their community, and to be an ambassador of sharing information. So it's not like you don't have to know all the data, but sometimes it's just about like the fears, right, that we talked about that people might have, how to have those conversations. So you could check out some of those videos and see if they're interesting or if it's helpful to share. And then the third piece about learning to talk about vaccinations, of course, is to know that we've got lots of toolkits and resources already created on the Vaccinate All 58 website. So you could, any one of those 3 things would give you some information and or tools to just learn and talk about vaccines, because that's important, especially as COVID fatigue might set in places, right? And one thing we know from these conversations is that it's the trusted messengers who are most successful in convincing folks to rethink their vaccination decision. So a lot of our work has gone into really empowering and providing resources to trusted messengers in their communities. You all are trusted messengers, just by the virtue of your leadership here in Cal-HOSA. So we want to be able to provide you as much resource as we can. Another option, so we can go on to the next slide, would be sort of go one step further, which is to actually specifically and intentionally utilize some of the resources to share in your community. We put together a back to school toolkit, which has event flyers, has newsletter articles, fact sheets, social media graphics. I know that many of the students and student officers have already also been developing their own social media work. So I just think that's incredible. And however you can help get the word out, if it's one of these sort of prepackaged things that you could take and adapt or create one yourself, that kind of outreach matters, again, from trusted messengers. So you could talk about it, you could actually like use some tools and do some intentional outreach. And then the third one I alluded to earlier, so our next slide, would be to consider hosting a vaccination clinic. And this is one I'd really like to spend a minute talking about. Given your orientation as an organization to supporting public health and helping people think about pathways, it might be a great project for a school, a student to consider doing, and we can really help. So there are mobile clinics that can come to different parts of the state. Sometimes they can even be paired with a food truck. And we can make that happen through a link that we've put. It's a very simple one-page form and application. And it's really designed to be able to, I think someone was talking about in the comments about, parents either haven't yet been willing to or can't have access to the resources. So let's just bring the resources where it's easy, right? Let's just bring mobile clinics. So you can absolutely request one. I'm seeing there's a comment. So is the vaccination clinic focused only on COVID, or can it do flu and COVID vaccination clinics? That's interesting. I think that would be a good question for us to do a little more research on too. I know some of the mobile clinics can do depending on the local jurisdiction, can do like the back to school immunizations all as a package. Not sure about the flu, but we can look that up. So I will follow up with Cindy afterwards with some additional information. So that's a good question, but I do know that some of them, depending on the local jurisdiction, can combine. So that would be something we could help look into once you have an application. Oh, glad to hear. That might be amazing. Yes, I really, really want to encourage this. I think it's such an important resource. And I think in particular, again, you all as trusted messengers being able to lead that locally would be a great way to support your community and to make a difference, because we know not only are vaccines safe and effective, but they really make a difference on how sick people get and whether people die. And we really want to be able to interrupt that, right? So maybe consider hosting a vaccination clinic. And then I'd like to talk about resources in a minute, but I see there's another comment, so I just want to address it. Most schools have started back to school, so it may not be relevant. However, flu season is coming. Yes, that's true. If schools have already gotten in session, have already come back to session, then you know, the back to school vaccines as an incentive may not be enough of a draw, but it could be that if you've done your data search and you notice vaccine rates in your zip code are very low, which is a search you could do just the vaccine clinic for just COVID-19, because there might be a tremendous need in your zip code. So it might be helpful to pair it with the flu season, maybe helpful to just do it on its own. It sort of depends on your local data and conditions. So really appreciate, these are really thoughtful questions. Okay, so just to recap then, so you could become a person who talks about the vaccine and shares information. You could do something a little more intentional, like a strategic share of information using the toolkits or other forms of data that you collect, or you could host a vaccination clinic. But one thing I always disliked when I was doing work locally with public schools, I had a long, good time working with public schools throughout California, is they're like, yeah, it's a great idea, but who's going to pay for it? Where are the resources? How does that work? So for the next slide, I wanted to share with you that another really awesome resource to consider, Dee, could you, oh, thank you, is to know that there are neighborhood partnership program grants available. These are awards of up to $5,000 per vaccine related event. So it doesn't have to be a mobile clinic. It could be like an information campaign if it has costs associated with it. There's information about like anything that's prohibited on the actual application. But generally speaking, any one organization could apply for up to $20,000. So basically up to 4 events and get funding to be able to do this work in your community. And I wanted to point out particularly that this is open to student clubs and service clubs. So I know that they have also additionally added in a new priority area just recently, which is about language access, because one of the things we've been really understanding with some of our outreach with trusted messengers is that some of the languages that we offer, while certainly pretty robust, are still not sufficient, that there are a lot of communities where maybe an indigenous community is speaking a dialect that we are just not getting to them, right? So there are lots of ways in which these neighborhood partnership programs have been used to fund getting information and vaccines into people's hands. I want you to know that you could apply anytime with that one. Again, it's a simple one page and they have lots of information about it. They'll walk you through the process. But just a heads up that you'd have to apply by November in order to be able to use the money up by December. So it would be for the first half of the school year. Oh, thanks Ashley for putting more information in about the link there. So I know that, we'll be sharing via Cindy and Dee this PowerPoint with everyone who's participated, but also, so you'll have the hyperlinks, but you should know that you can also reach out to us anytime, and we would be very happy to get you this information directly as well. Okay, so next slide. which is really to say thank you. You've probably noticed throughout the presentation that we have pictures that we've been sharing. These are all examples of the social media graphics that are available on the Vaccinate All 58 website. So we had a graduation toolkit at the end of the school year last year. This is from that, and it's just an example of, we offer everything in English and Spanish, and then many things in multiple languages. But the toolkit graphics that you'll find are almost always at least English and Spanish. And they cover all ages. And I've tried to sprinkle a plethora of those examples through. So before we wrap up, I just wondered if anybody had any comments or questions either about the data that we haven't covered yet, or comments or thoughts or worries or concerns or excitement about the possibility of doing a call to action.
I have a question.
Yes.
Will this be presented also at the Fall Leadership Conference to entice more chapters maybe to participate?
Well,
June, this is
I want to say yes, but I'm sure
Yeah.
I don't really actually have any authority in this area.
June, we have invited, and everyone, we have invited CDPH to be our guest speaker for opening the virtual Fall Leadership Conference. So we are working on the logistics of that because of the importance of this project. So a mighty big yes on that. Thank you for the question.
I see there's also a question in the chat about whether there's a cost to hosting the vaccination clinic. There is no cost for the mobile clinic to come to the community, nor if there's a food truck, that's also covered, I think up to 200 meals. And those are really designed, by the way, for the folks getting the vaccine or their loved ones who are bringing them to the event. But the neighborhood partnership program grant is available so that if you have sort of collateral costs connected to it, that you have a way of being able to take care of that without, incurring debt to be able to do some good work. Any other questions? I know we're almost at time, but just really, again, before I turn it back to Cindy, thank you all so much for your attention, for your thoughtful comments and feedback, and most importantly, for all the work that you're doing to ensure quality leadership and public health moving forward. Really, really appreciate that. It's never been more important than it's been the last few years. So thank you all.
Carrie, I have a quick question.
Oh, sure. Yeah.
Have you already worked with school districts? Is there resistance by districts to having this on campuses? Are there insurance issues? Has there already been a road paved to make it happen?
Yeah, I don't think you should run in. I mean, each school district is its own district, but there has been a very robust partnership between the California Department of Public Health and schools in California, particularly in the last school year. So it wouldn't be unusual for a vaccine clinic to be at a school, generally speaking. I'm not entirely sure what the push has been so far, because so much of the data and where we're trying to support our resources is around the younger kids right now. So I can find out about, but just know that last year there was a very robust, healthy vaccine clinic effort happening between CDPH and public schools in California.
Okay, thanks.
Sure. Yeah.
Sorry, do you
No,
have like a toolkit? Let's say my chapter wants to do a vaccine clinic, but I don't know where to start. And then do you have like a toolkit that we can follow, like for example, assess what is the needs of the community, and then step 2, contact this, and so on and so forth. I'm just wondering if there's one to make it easier for us to plan.
Yeah, that's a really good question. I don't know. I know that the mobile vaccine clinic application has some of those, like if you go to the link that we have for them, they'll really walk you through like, so you want to have a clinic, and they have like a real step-by-step kind of thought process before you like submit the 1-page paper. So that would probably be the best place to start. but I can also do some follow-up and see if there's any particular requirements there. I think generally speaking, the most important thing is for you to have a sense that it's needed or wanted. I think that's more of what they're looking for. They're more interested if we're deploying this resource, which does cost some money. You know, we don't want it to not be utilized the day that it's there. Right. So I don't think it's like you have to hit a certain number of like people in your county who haven't been vaccinated or anything. It's more like, do you have a plan to get, you know, folks out if the resource is there? Ashley, is there anything you wanted to add on that? I'm sorry if I took all that space.
No, I was just trying to find the link for the mobile clinics actually, but no, I think you got it. And I see a comment here that our district, the district that they are in is doing clinics through their local health jurisdiction, their local public health branch. And
Yes.
so many different entities are, I mean, everybody's pitching in to do what they can to make sure that vaccines are available to everybody. So it's great to hear that Pasadena is doing that. And I know each public health department does have their own way, their own clinics and things of that nature. So yeah, we're just trying to also, you know, make it easier for folks to be able to host one if they think their community needs it, like you all said. So yeah.
I dropped my email in the chat as well. So feel free to follow up with me directly after today too, if you have more questions or you're not finding the resource and where we sent you. Usually you should be able to, but just in case. Yeah. And again, I know I want to be respectful of everyone's time. So thank you so much, everyone. Please follow up. Please feel free to take advantage of all of those resources. They're there for the use. And special thank you to you, Cindy and Dee, for making it possible for us to be able to do this today.
I just want to add, thank you, Carrie and Ashley, for providing this information to us. It's so valuable. We have lived through COVID for the last 3 years in our schools, and we have seen what has happened. And so it's such a valuable resource to give people so they can make choices on their own and they can understand how to make those choices and why they make those choices. So thank you very much. I appreciate the partnership. I appreciate your confidence in our Cal-HOSA organization and the chapters. You'll see from the questions, we have great students and advisors. And then most of all, students, thank you for being here. All of you, we really appreciate when students join in our conversation and add to that. After all, we are a student-led organization. Teachers, advisors, thank you for being here. I know it's a long day. Some of you are in session till 4:30 now. We're starting later. Your day is longer. There's lots of reasons, and you guys put that aside to be here. So I want to give a thank you to all of you. You know, we're always trying to provide resources, and I am so excited for you to do some of this work. So once you do the work and you have the clinic or you do an on-campus type of rollout, please let us know. Be proud of what you've done and share with Carrie, Ashley, and Cal-HOSA what you've done, because we do want to say thank you once again. So with that, anybody else have any comments? We'll talk to you next time, because we will be doing this. Don't forget the Fall Leadership Conference. We will have our special guests there and repeat some of this information.